welcome to Medical Dialogues. I'm Roshni Dhar. Let's look at today's top headlines. 900 NEET SS seats still vacant. Pointing out that more than 900 super specialty seats are lying vacant even after the NEET SS mop-up round, the doctors under the umbrella of Federation of Resident Doctors Association have recently urged the MCC to conduct another mop-up round for filling up the vacant seats. Writing to the DGHS, Fora pointed out that NEET SS seats are a national asset and should not go vacant. With this, the association urged the DGHS for conducting another mop-up round in the larger interest of students and citizens who stand to benefit immensely from having more super specialty doctors in the country. Doctor shortage in Punjab, MBBS MD graduates to be recruited at government hospitals. Referring to the shortage of specialist doctors in the state, the Health, Medical Education and Research Minister Dr. Balbir Singh clarified before the State Assembly that after completing the PG medical courses, the newly graduated specialist doctors will provide their services in the government hospitals. Apart from this, the Health Minister of the state also pointed out how the previous government failed to ensure that PG medical graduates from government medical colleges provided their services to the government and hospitals for a few years and how the bond penalty amount was also not recovered from them. Orthopaedic surgeon guilty of medical negligence liable to pay ₹50 lakh as compensation. Holding medical negligence by an orthopedic surgeon during fracture surgery, the Nagpur-based Disputes Consumer Redressal Forum has granted compensation of ₹15 lakh to a patient. The patient filed a plea before the forum asking for compensation of ₹20 lakhs against the orthopedic surgeon and the insurance company, which identified the doctor during treatment, alleging that the surgeon was negligent in discharging his duties. The case goes back to the year 2012 when the patient, who was a mason by profession, met with an accident and received a fracture injury on his right leg. Therefore, he approached Hirachand Munod Criticare Hospital, where he was admitted from 15 to 4th of March 2012. Post-COVID, chest pains may linger for up to a year according to a new study. People who have COVID-19 may experience lingering chest pains for up to a year after infection, a new study found. Long COVID, which refers to conditions that linger for months or even after infection, impacts nearly 1 in 5 people who have had the virus, the Centers for Disease Control and Prevention has reported. Researchers at Intermountain Health, a non-profit healthcare system based in Salt Lake City, Utah, examined over 140,000 adult patients for cardiovascular symptoms. Dr. Hedy May, a cardiovascular epidemiologist at Intermountain Health, said, "While we did not see any significant rates of major events like heart attack or stroke in patients who had an initial mild infection, we did find chest pains to be a persistent problem, which could be a sign of future cardiovascular complications." Indian pharma firm grew faster at 7% compared to a 4% of MNCs in 2022. The Indian pharmaceutical market has reflected growth of 7% in the year 2022, with overall IPM market size at ₹193,838 crore, moving annual turnover as per IQVIA. As per the report, the growth in sales value was recorded at 7% and chronic TAS growth outperformed acute TAS growth in 2022. The relative performance of the Indian pharma companies grew faster at 7% compared to MNCs, which grew at 4% in 2022. Further, the number of new launches have increased by 2% to 32 in 2022 as compared to 2021. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.